3 seconds from now.
Good morning. I'm Dave Anderson, and I serve as chairperson of the Master's Level Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I asked the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Shelley Duncan is not present. Susan Montague.
Present.
Iris Pauley. Thomas Pletcher.
Present.
Joshua Tangaway.
Present.
I note the following staff members are also present. Executive Director David Fye and
Here.
Ashley Van Buskirk.
Here.
And Dave, just to let you know, Iris Pauley is currently joining from the waiting room.
I haven't seen her pop up yet.
Yeah, it looks like there's a delay in her joining the room, but if you want, I can go ahead and read the open meeting information and then
Absolutely.
circle back around. Okay. My name is David Fye. I'm the Executive Director for the Behavioral Sciences Regulatory Board. And public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or to answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting the meeting remotely by conference call and other teleconference ability, I state for the record the following information. The meeting is being conducted remotely. However, access to the meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is being conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On July 21st, 2021, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meetings. The notice was also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials has been posted to the board's website and was posted on the day of the meeting. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240. A recording of the meeting will be available on the Bsrb YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Dave, I can verify that Iris Pauley has now joined the Zoom call.
Morning, Iris. Okay, meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda. Are there any additions to the agenda? Hearing none, I would seek a motion to approve the agenda.
So move.
Thank you. Second. Iris, we can't hear you, at least I can't. Can anybody hear Iris?
No.
Well, for the record, we know she attempted to second that motion. All in favor, say aye.
Aye.
Aye. Opposed, same sign. Motion carried. Is everybody had the opportunity to review the minutes from June 17th? Yes.
Yes.
Are there any requests for changes or updates to the minutes? If not, we'll take a motion for the approval of the minutes.
I move to approve the minutes.
Thank you. A
I'll
second.
second it.
Thank you. All in favor, say aye.
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 Very good. Minutes stand approved. I'm assuming that she has logged out to try and get back in to see if that resolves her.
Yes, Iris logged out, and then I just let her back in through the waiting room. So hopefully that will resolve the audio issue.
All right, Iris, let's try again.
Hi there. Can you hear me?
Now we can.
Okay, sorry about that. Obviously, I'm having problems. I apologize for my delay.
Well, you're fine. All right, we are at the executive director's report.
Thank you, Dave. And I will advise the advisory committee on a few items, update you on some information. First, at the last meeting of the board, there was an election for new chair and vice chair. This happens at the beginning of every fiscal year. So at the meeting in July, the board voted that the then vice chair, Leslie C. Wester, would become the new chair of the board. So Leslie C. Wester has taken office as of the conclusion of that meeting. And the new vice chair for the board is Dave Anderson. So we congratulate them both, and I look forward to working with them for the next year. Danielle Johnson has been a public member of the board. She recently resigned. She accepted a new position as the new director for Habitat for Humanity. And due to conflicts with scheduling, she resigned her position, but thanked the board for allowing her to serve. And she indicated that she enjoyed her time with the board. Since that time, we've been in conversations with the governor's office to identify a new member of the board. The governor did inform us just recently that they have appointed Donna Honer-Queel as a new public member of the board. And we look forward to welcoming her. She will be attending the next meeting of the board in September, on September 13th. And at that time, she will officially be appointed to different committees, and we'll get a chance to meet the rest of the board members. Here at the office of the Bsrb, as we kind of indicated in the past, due to the passage of House Bill 2066, that was a bill that would expedite the processing time for applications for certain military members, military spouses, and other individuals in certain cases. That is a half-time position that we were allowed to add for this fiscal year. We recently had a staff member on our licensing side resign. And so we are in the process right now of looking at current responsibilities of Vsrb staff members. We do plan to advertise and hire for both of those positions, but we will be probably reallocating certain certain items and position descriptions prior to that, so that the new member of our staff, the new members, will be able to come on board and be effective right away. So that's where we're at with the hiring process. The last time that your advisory committee met, there was information that had recently come out about the state of emergency related to the pandemic. As of the middle of June, the state of emergency in Kansas related to the pandemic has officially ended, and staff of the Bsrb were asked to return to the office full-time as of June 14th. We did implement a telework pilot program, which has been approved by the Department of Administration. We are starting it small, and we are looking to expand it as we collect information about the successful nature of the teleworking, and looking to expand it to other members of the staff as we go forward. As of about 2 weeks ago, the governor's office reinstituted a requirement that masks must be worn in state buildings by state employees. Prior to that, They had said if you were vaccinated, you no longer had to socially distance or wear the mask in state buildings. That changed about 2 weeks ago. So we have returned to the social distancing for everyone and in common areas wearing the masks. And so that has affected some logistical issues in terms of the board had planned to try to return to the office here in Topeka for a board meeting in person in September. However, based on the spacing issues and other issues, that has been moved back to virtual. So we are working with the logistics and trying to keep everybody safe moving forward as well. In terms of the budget for the Bsrb, we did conclude the fiscal year 2021. As you might recall, during much of fiscal year 2021, there was a delay on the enforcement of expiration of licenses. That was through some governor's executive orders relating to the state of emergency. Those ended back at the end of May. And so in the beginning of May, we sent notice to the individuals whose license had expired during the pandemic, letting them know they needed to take action prior to May 28th. And so when we went ahead and sent that notice, and since that time, we've been able to enforce the expiration of licenses. So we have had additional revenue come in after that message was sent. And overall, for the last fiscal year, revenue was slightly up above what was previously estimated. So that is good news. Our costs were lower. Some of that had to do with some savings related to the pandemic. And also we budget money in the eventuality that we might need to have some expert witness assist the board. In certain cases or more cases might go to the hearing level, which can be very costly. So thankfully we did not have to spend as much as we budgeted. We came in under budget. However, we did spend more than we brought in revenue wise, and that is by design. A couple of years ago, the board lowered some licensure fees to gradually reduce the amount of balance in the fee fund. The fee fund balance is about $2 million right now. It is anticipated that over the next 10 years or so, that number will draw down to the point to where some changes will have to be made at a certain point to bring that more back into balance. But the good news is that the pandemic did not greatly affect the revenue. And so the agency is in good financial status. The board has planned a once a year offsite meeting / retreat for doing a lot of more in-depth discussions. That was tentatively scheduled for the weekend of Sunday, September 26th and Monday, September 27th. It was planned to be in Olathe. We are still holding hope that could happen in person. However, given new conditions, we think it is likely that we'll probably have to move either virtual or we'll have to pursue some different options that we can safely space everyone out. So we're still looking at logistics for that, but that is still planned to be mostly on that Monday, September 27th. And concerning the rollout of House Bill 2066, which I discussed a little bit earlier, we have made changes to our applications in terms of reciprocity to make sure that we are expediting those applications. We've also worked with the Board of Healing Arts. They have our online licensing system. And so we are tracking individuals who fall into the categories of 2066. At the end of the year, we are required to provide a report and indicate the timeframes for processing certain applications that fit into those categories. So we're trying to be in compliance with the provisions of that bill. And then one other item I wanted to make you aware of, we are starting to come to the point to where a lot of the national associations are having their annual meetings. There was a meeting by the National Board of Certified Counselors in Denver, Colorado in August, early August. And I was able to participate in some of those activities and it was a very helpful conference. I plan to attend more of them virtually in the fall, possibly one in person for the Social Work Association. But it was a very productive conference and I was able to make a number of contacts. There is a multi-state compact for professional counselors, and based on the connections that I was able to make at that conference, I was able to sit in on a call with the Mississippi Board for Professional Counselors this past Friday to hear a representative of the Council of State Governments talk a little bit about how they put together that language. So those relationships are very important, and I look forward to making more connections so I can bring back more information for the board and all the advisory committees. And with that, I will conclude my report and I can stand for any questions.
Dave, I had a question. Do we know yet the number of people who did not renew licensure post-COVID? And was it significantly different than it would have been in any other time period?
So as of when we identified that there were, in early May, we identified that the number was about 800 people or 800 licenses that had not renewed, that had expired during the pandemic. I don't really have any numbers to compare to other time periods. We did get contacted by a number of those people who said that they had chosen to either retire or that person was not practicing for one reason or another. But I'll try to look a little deeper and see how that compares. The issue with that is that went from about March of 2020 through part of May of 2021. So it was a pretty long period of time. And if anyone didn't renew during that time period, based on the executive orders, we put their new expiration date as that May 31st date. But I'll look at that. The number we were looking at before was about 800 licenses, but I'll see if we can get more data on the normal rate that licensees drop off and see how it compares to some of the recent time period.
Dave, I will say in the past, it has been roughly, if you divide it by the amount of months that were expired, it's roughly the same. I mean, it's 50 something people per month drop off, and then some of them do reinstate, but that's close to normal as it has been in the past, at least.
Okay. And that was Ashley Van Buskirk. She is one of our administrative assistants, our senior administrative assistant here at the Bsrb, and helps a lot with the licensing side of the office.
Thank you, Ashley. Anybody else have questions?
Do you foresee, when you make connections, thinking about how reciprocity could be happening between states with our practitioners or people coming into the state?
That's, I'd like to get into more of those types of conversations. Right now, the hot topics tend to be these multi-state compacts that a lot of disciplines are discussing. But I will add reciprocity to the list of items to have some conversations about.
Anyone else? All right, we'll move on to old business. Dave, I know you included some information kind of talking about how the advisory committees are to function. You want to briefly go over that?
Sure. Yes. So there are several advisory committees right now with the Vsrb who are in the process of looking at adding members to the advisory committee. And there is a board governance policy document from 2011 that provides some insight on this. There are also historical practices. And so I had some conversations with a number of people, and I took the information that I could locate, put it together in just a short one-page summary. So I thought I'd walk through some of this as you prepare to consider applicants for the advisory committees. So first, the purpose of the advisory committees has been to support the board of the Bsrb in carrying out its mission, which is primarily to protect the public. And members serve at the pleasure of the board. Advisory committees, their primary role is to work on informing and assisting with the licensing and discipline of those persons regulated by the board. And there is a separate advisory committee for each of the professions overseen by the board. The advisory committee members receive issues to discuss from the board or from the chair of the advisory committee or the executive director, and the advisory committees themselves may suggest topics or recommendations to be forwarded to the board through the chair of the advisory committee. In terms of the structure of the advisory committees, so the chairperson of the advisory committee is a board member licensed in the relevant discipline of the advisory committee. And then a public member of the board is also a member. And then the other individuals I will call non-board members of the advisory committee. And so those non-board members, the board governance policy indicates there should be no fewer then 3 non-board members on the advisory committee. It does not specify a maximum. However, in discussions with several people, it seems like the tradition has been not to have more than 10 non-board members on an advisory committee. And I think that was largely due to when you have a board member, a public member, and then you have 10 other individuals, that would be the size of the board, 12 members. So I think even though it's not specifically stated, that it's been the tradition to not have more than 10 members that are not board members. And then in terms of the terms of the advisory committee, so the advisory committee members serve 2-year terms, and the board governance policy indicates that members will serve no more than 4 terms. So same length of time as the board members. The board members serve 2 4-year terms for a total of 8 years. Advisory committee members can serve for 2-year terms, so up to 8 years. And then appointments to the advisory committee should be staggered, is what the board governance policy indicates. Now, one thing I will mention here is that for board membership, what has been the practice at times is that a member will serve the 2 4-year terms. And then if a board member is not appointed to fill that role, sometimes board members will continue to serve until another member has been appointed. So that's just something to think about in terms of the advisory committees. It doesn't specify that that's not the practice, whether that is the practice, but that has been the practice for the board. And there are some indications in the advisory committee policies that a lot of the responsibilities of advisory committee members should mirror those of the board. In terms of the selection of advisory committee members, it indicates that the advisory committee members, individuals wishing to serve, can be nominated by anyone, including themselves. And so what we did for the master's level psychologists, the LMLPs and the LCPs, was we sent an email to all licensees asking if they wish to serve on the advisory committee or be considered for membership, that they send to me a letter of interest and then a resume, and some went ahead and sent a CV in place or in addition to the resume. And then it indicates the board governance policy that the advisory committee will review the nominations and should work to ensure that there's representation based on geographical, gender, and public versus private settings distribution, and that the members should provide representation to the different levels of licensing in that discipline. And it suggested that those members be selected from among the public and private practitioners as well as educators. As far as the process, it indicates that the discussion on potential advisory committee members will be done as a public discussion. It will be in an open meeting. And it indicates that the resume letter of interest will be reviewed by the members. And then the chair of the advisory committee will eventually submit the names of the nominees to the Bsrb board chair at a board meeting. It has been the historical practice that the advisory committees will come up with recommendations on who the advisory committee would recommend be added to the advisory committee. So to make those two things put together, essentially what you will be asked to do is to review the candidates and come up with recommendations on individuals that you believe meets these criteria and would be good additions to the advisory committee. And then the chair of the board will receive your recommendations as well as the list of names for the other people who decided to nominate themselves for consideration. Ultimately, adding members to the advisory committee is a power of the chair of the board. So members will not be added to the advisory committee until going before a board meeting. And then at that time, the chair will go ahead and name people to the advisory committee. And I think that kind of specifies out the different criteria that was found in the board governance document in the historical context. One thing that I did to assist the work of the advisory committee is I collected all the information and distributed that to you for your review. I did verify that each member who had applied for consideration does have a current active license under the Bsrb. I also went ahead and looked at if there were any current or any disciplinary issues for any of the licensees. I wanted to make you aware of that. I did a check on disciplinary issues, and I could not find any disciplinary items that were public for any of the individuals. So I just wanted to relay that for you. And I am happy to assist with the mechanics of this process. In terms of which individuals might be good candidates, I will stay neutral in that process and just focus on facilitating this part of the meeting.
Thanks, Dave. Excellent summary. So one thing that we've had to deal with is that we've, through no fault of anyone's, we've got some folks who've been on our advisory committee selflessly serving, but we've exceeded the amount of time we should have had folks on. So we're going to be rotating off two folks, Tom and Susan. Tom, 24 years of service to the profession, and Susan, 17 years of serving on this advisory committee. And I want to take a moment to say how much I appreciate that, because it's not always easy to get people to participate in these kinds of organizations, and your willingness to do so for such a significant amount of time is greatly appreciated.
That's awesome.
Okay, so have you all had an opportunity to review those folks who have put themselves forth for consideration?
Yes.
And do we want to go through them one by one, or do people have any comments they want to make? Look like a strong group of candidates, people with a lot of years of experience in various settings.
I'm fine with going through them one by one if you think we can do that.
Okay. So I guess we would start on my list with Travis Hamrick, who currently works at Larned. Is it the correctional facility? Yeah, the security program at Larned State Hospital.
Looks like the Larned State Hospital, right? And it appears that he's also still working at the Great Bend Mental Health Center.
Yeah, looks like he's doing some part-time outpatient work there.
Can we clarify how many people you plan to accept at this point? Do you plan to have a number that you definitely want?
Are you talking about in terms of the committee size, or the number we're going to take this time?
The number we're going to take this time?
2.
2. Okay.
So Travis looks like, again, solid candidate. The CMHC, which we already have some folks representing CMHCs, is also in a region, and Josh and myself currently cover as well. If we were looking regionally, I think we were hoping for maybe northeast, southwest, southeast, look like areas we didn't have the kind of representation.
Yeah. His letter was a bit weak as well. I noticed that the others had a little more to say about why they wanted to be on the committee, and there was not a lot there on his that spoke to that.
Anybody else have any feedback?
I'd agree with Iris.
Same. I have one quick question though, thinking
Sure.
about, so with Susan and Tom departing, that means what geographic regions do we have? So we have, I know Dave, you and I kind of Western area. Iris, are you kind of Wichita area? I forget, I'm sorry.
That's okay. Yeah, I'm Wichita. I work at a community mental health center in Butler that covers El Dorado, Augusta, and Andover, and then I live in Wichita.
I'm in the north central part of the state in Salina.
All right, second candidate is Rebecca Jabara.
I liked her letter quite a bit, as well as her resume. I think she is, I mean, she seems to do a lot of work with schools, which I think is an important area of coverage and involved a lot in that. So in terms of thinking of diversity with areas of practice, I thought she was, she could be a really good fit that way.
It looked like she had a private practice as well.
Yes, she does that too. So, so just good, some really good training she's been through, and evaluations and all that. So,
Anybody else have any particular feedback?
I agree. I think the area that I was just viewing is that she was another Wichita one, so I didn't know about that.
Right. But we'll be losing Tom, who's also next. Is Lauren. Do you know how to pronounce her last name, anyone? Luch? And if you watch this on YouTube, Lauren, I apologize for butchering your name. And Dave, did Shelley weigh in on Lauren?
I will have to check. She weighed in on one candidate, but I will double check who that was.
Thought that's who she had mentioned. So she's from Kansas City area, represents University of Kansas Health Systems.
I liked the that she had kind of the overall health component piece. She looks like she's had many years of experience, and then she has a lot of work with maybe multi-disciplinary. So looking at the medical piece, dental, and behavioral health, which I thought was interesting. Lots of research as well.
I think for me, some positives there were both geographic diversity and also the size and type of organization with which she's affiliated is a strength.
I agree.
Dave, I did check Shelley's message. She was supportive of another candidate. I believe that was Chantelle Westbrook.
Okay, thank you. Who's next on our list?
I've actually known Chantelle for many years, and when she first learned that I was on the advisory board, this was quite some time ago, she was very interested and asking even at that time how one got appointed to such a thing. So I know that she's both a strong clinician, has a good experience, well respected, and has a long-standing interest in this type of service.
I would agree also. She brings a lot in regard to working with children and has a good sense of diverse populations, including working with the foster care system and child and family pieces too. So she would be one of my higher priority candidates too.
Yeah, I'd agree. One of the things that I think is a little bit different, Iris, with you being in Wichita, that's great. But I think you represent a smaller CMHC, which is very different than the large CMHC system that Chantelle represents or would be coming from. So that
Right.
is a good balance.
Yeah, I've known Chantelle a long time myself as well. And my only concern about her was she did work at a CMHC, and as we try to maintain some kind of overall balance, but otherwise I have nothing but positive things to say about her. Which brings us to Ken Windholtz, another person who I've known for my entire career. Again, he's kind of like Josh. I mean, he's almost exactly like Josh, in that he's a Fort Hays State faculty member and lives in the same area we do. Really strong clinician, really bright man, dedicated to the profession for decades. Josh, did you?
I'd just like to say for the record, Ken is nothing like me. He's a much better person than I am. And I just truly respect him, and he's about as genuine as they come. So he'd be a major asset to any board. I understand, the possible conflict with geographics and all that, but being, of course, full support of him. His experience with psychotherapy is unparalleled, I believe.
Yeah, I just think that unfortunately he's representative of an area, and we've got an educator, and so in our attempt to kind of maintain some balance, if we didn't have Josh, he would be a really, really good fit. Anybody else have any feedback? Which takes us to our last candidate, Carrie Wald. Who provided both a CV and a resume. And I'm unfamiliar with the group that she works for. Is anybody?
I am. Yeah, I am. I actually, I was surprised to see her name because I have actually consulted with her this past year. I can't remember the name of the group, but she does a lot of assessments, and they have some specialty in the area of autism. So I was seeking consultation for starting up doing more assessments along those lines. And she was extremely knowledgeable, very professional, knows what she's doing in that arena. So I had positive experiences with her.
Very good. Thanks for sharing that. Anybody else have any comments?
I just wanted to give her props for, applying with whatever happens. Obviously, I think she said she's been in practice for about 5 years or so. So that's pretty awesome. She's even aware of stuff like this. And my thought was that if, major positive is that sometimes people who are so fresh have a fresh perspective on things. That was my thought.
Very good.
She's also from the Washburn program. And we just had a couple practicum students from there this past year who were actually, we had one and then we got another one to come work for us. But man, that program is a strong program. I've been really impressed. So I think she said that one of the professors there encouraged her to apply. So they're they were just very involved there. I've been impressed with that program.
Yeah, like I said, it's nice to get it's always good to have a strong group of candidates, and any of them would probably be very good committee members. What's the group's feelings? Do you want to give your top three, 1, 2, 3, and then we'll figure out who our top 2 candidates are? Or how else would you prefer to do that?
That would work for me.
Okay,
Sounds good.
Dave, can you keep track of this?
Yes.
All right, Josh.
Oh man, on the spot. Okay. I don't know. I can't think of a particular order right now, but mine would be Rebecca J, Lauren L, and Ken Windholtz.
All right, next would be Tom. I'm just going down my screen in the order you are in.
Sure. My 3 would be Westbrook, Lute, and Wald.
In that order?
Yeah, I think so.
Okay. Susan?
I would go with Chantelle, Lauren, and Carrie.
Iris?
Sorry. I would go with Lauren as number 1, Carrie as number 2, and Rebecca as number 3.
And I had Lauren as number 1, Rebecca as number 2, and Carrie as number 3. So how did that end up?
Here would be a thought. Would we want to do at least bring 3 on, knowing that Shelley has also been on for a long time and will be coming off before long?
Certainly open to considering that. And you're right that Shelley's just right behind you at 16 years, and we'll need to.
But she's also a Wichita person too, so.
How did our order end up, Dave?
So what I did is if someone was in the top 3, I gave them a check. So I wasn't able to rank them based on 1, 2, and 3s, but Lauren received essentially 5 votes. Carrie received 4 votes, and Rebecca received 3, Chantelle 2, and then Kenneth 1.
So that means Lauren, Rebecca, and Carrie were our top 3?
Yes.
And the top 2 were Lauren and Rebecca, or Carrie?
The top 2 would be Lauren with 5 votes, Carrie with 4 votes, or Lauren with 5 votes, Carrie with 4 votes. And one thing I would mention too is, so Shelley did send that email mentioning her support of Chantelle. So if you wanted to count that as a vote, it just depends on how you want to quantify that. But the top 2 based on votes would be Lauren with 5, Carrie with 4, and then at the meeting today, Rebecca received 3, Chantelle received 2, and then Shelley had mentioned Chantelle.
All right, so we've got a consensus on the two. Thoughts about Susan's idea of bringing three on with the thought of transitioning Shelley off next year. My only reason not for kind of transitioning everybody who was over the 8-year limit was we would go from a lot of experience to only people with 1 year or less, excluding me, on this committee, and that's unfortunate. So,
Dave, one of the things I would at least raise, and I don't know whether this is anything or not, is that you represent CMHC, as does Iris. And those are the only CMHC representatives that you have for a system that covers the state.
And I do know Chantelle understands the foster care system and children, and that's a large portion of kids that we have to deal with oftentimes.
I'd be fine with bringing three on. I mean, that was my thought too, Susan, that someone, I mean, even though there may not be a lot of board experience, we'll figure it out. And Dave, your father time, you'll teach us. So, I think we'll be okay. My only reservation with it was, I don't know if we would do another call out for applications, because it would be nice to get someone from Southwest, that air quadrant of the state. I just feel like they're underrepresented in everything. But that was my only reservation. Otherwise, I'm all game for bringing.
Well, and North Central will not be represented when I step off too. So that if you did another call out, that would be an area that you'd want to focus on too.
so that means if I have this right, we've decided on Carrie and Lauren, and essentially if we include Shelley's, then Chantelle and Rebecca were tied with 3. Is that right, Dave?
That's right.
Well, let's see, I guess we could do another vote for between Chantelle and Rebecca, since not everybody here voted for one of them, and see if we can break our tie that way. People comfortable with that? Okay, we'll go the opposite direction this time. We'll start with Iris.
I vote for Rebecca.
Okay, Susan,
Chantelle,
Tom. You're muted. I think you said Chantelle, but I want to make sure.
Yeah, Chantelle.
All right, Josh,
I'm going to stick with Rebecca.
well, and Rebecca was my second pick, so I too will stick with her. So that then is the third. So we've got our 3, and Dave, if I understood what you said in your summary, then at the next full board meeting, when I provide the summary of this meeting, I would give the total list of applicants as well as our 3 recommendations to the chair, who will then appoint the members to this committee?
Yes, so the power to appoint to an advisory committee is under the chair of the board. And so we'll help you put something together that will identify the individuals recommended by the advisory committee to be added to the advisory committee. And then under that, it'll probably say something like other individuals who were nominated for consideration. And so the chair of the board will receive the full list of everyone who was nominated, but specifying who the advisory committee recommended. And so it says that the chair of the board will make the decision, has the power to appoint and can collect input prior to making that decision. So we might try to coordinate a conversation between you and the chair ahead of the board meeting, so that if she wants to collect input, she has the opportunity to do that. So I'll work with you after the meeting. We can put that together. And then at the board meeting, you can kind of discuss the process.
Very good. What would that put us at in total number for the committee?
So if two members were removed and then 3 were added, your non-board members would be at 7. And then you would be the 8th member, and there would be a new public member appointed. So that would put you at 9. But in terms of non-board members, you would be at 7. Total members, you would be at 9 total.
That includes Shelley?
Yes. Mhm. Yes, if the chair removed Susan and Thomas and then added Lauren, Carrie, and Rebecca, then once she had also named a public member, total members of the advisory committee would be 9. For the board member, the public member, and then 7 non-board members. But I think just technically, board governance policy also indicates that I'm a non-voting member of the committee, but I'll just put that to the side. So really, in terms of people who receive votes, it would be 9 people.
All right. Everybody comfortable with that?
Yeah. I think you have a good group to move forward with.
All right. Well, thank you all for that. I think that was a really good process. Appreciate your input. Moving to our next item. We had discussed records of deceased providers, and I think we had come to a consensus. This is an issue, I think, Dave, that the full board is going to take up in September.
Yes, that's right. The records of deceased practitioners or providers. So your advisory committee, I went back and reviewed the minutes. You had a brief discussion on those back at the April meeting and then discussed that topic a little bit more in June. And the board has dedicated some time at the September 27th meeting to have more discussions about what to put forward as a option for that. And so that's kind of where that item sits currently.
And am I right? Was it the kind of consensus of this group that it made sense to have some attestation on the renewal application that people would indicate that they did have a plan, and maybe to name who would be the recipient of those records? Was that what we talked about?
So I went back and reviewed the minutes. I couldn't find a specific recommendation, but I seem to recall that there was positive comments by the advisory committee towards having someone identified to be the custodian of records should there not be a logical custodian in place. For example, if you worked at a facility that would have the custodianship of those records. Some of the other advisory committees had talked about whether to acknowledge that you do have someone or to actually list that person. So if you wanted to take a position on that item, I could go ahead and note that in the minutes for the meeting too.
Thoughts?
I thought we talked about maybe like a random type audit of it as well.
How so? Refresh my memory.
I can't remember exactly, but almost kind of like the CEU, that it's randomly pulled, but I kind of like it just being on the renewal.
I'd agree.
The other thing to think about, I think when you look at the legal aspects of record management, when we hired a record management firm, we went through the length of time that all records have to be kept. And so there does become that factor that after roughly 7 to 10 years, depending on your profession, or 10 years past majority, you don't have to legally keep the records. So it might be good to take a look at those legal aspects of record keeping to determine, how long do you keep those records? Do certain records, can you just send back to your client? Like a psych assessment or a discharge summary, and that be the end of the record management piece after the legal length of time that you have to keep records. It's something to probably look at.
Josh, do you have a thought about this?
Sorry, I actually really don't. I apologize. Just kind of listening in.
Yeah, so I think in regard to what Susan said, that's certainly an obligation on the part of the practitioner to know what that retention, what those laws are and what they need to do. This is, as I understand it, really more of a, in case of something happening, there's a plan for who becomes the custodian of those records. Is that right, Dave?
Yes, so this would be in situations where there's not already a custodian in place. For example, if you had a private practitioner who practiced out of their home and then passed away, who would take possession of those records, and then who would be the custodian in case someone requested to receive the records and things like that.
But oftentimes when things are set forth, we don't always think about all those details. That's why I think we need to incorporate those years past client retention requirements. Because it may be that somebody could be retired maintaining their license and, have closed up and moved those records forward based upon retention laws.
We know what medical professions do.
So the Board of Healing Arts does have a statute in place. So we could try to do something similar to that. In terms of the mechanics, what have been discussed so far was adjusting the language for the professional conduct regulation to make clear that this was something that was going to be expected of practitioners. And then once that had been through the regulatory process, then we could add it to the application. But we will be talking with the advisor of statutes to see, might this be something better put in statute, and then regulation would go with the statute. So we were looking at both of those options, but there would need to be some sort of an official, whether it's regulations or statute and regulations, before we would make the modification. And part of that is awareness for practitioners.
I think there are probably many different durations that are recommended based on different professions. I would want to, my own personal thought is I would want to make sure that we are not taking the greatest number of those records just from the burden of, for those people who are doing private practice versus in an institution. In an organization, it's no big deal. They just go on and it's handled as always. But for those people that are practicing independently, I think we want to be mindful of the fact that we don't want this to be an eternal maintenance of records.
And maybe that's something one of the assistant attorney generals could weigh in on for the full board.
Dave, are you saying to ask an attorney?
I'm always hesitant to ask an attorney. But I think given what's been raised, it's probably wise for us to know kind of what part of that is a board responsibility versus what part of this is a practitioner responsibility, and how do we meld those two? And that's why we pay those folks, right, Dave?
They do help us out. And I can ask the Attorney General who's working with us now, Lainey Barnard. Jan Arndt, who had worked with the board in the past, she did retire recently. So Lainey is serving as the new primary legal counsel for the Attorney General's office for the board.
Very good, thank you. Dave, you had an update on the 988 National Suicide Prevention Hotline?
Yes, so the 988 number and the change to that was discussed at the last advisory committee meeting. I tried to find just some more general information on the 988 process. And so I pulled a fact sheet from the FCC's website, just a one page talking about from August 2019, some of the development and then the transition over to the National Suicide Prevention Lifeline by July 16th, 2022. So it just includes a little bit of information about the 988 process and the movement towards that. There's also some questions about how the 988 was going to be funded. And so I did a little research on my own and was coming up with some strange results. And so I reached out to the Kansas Legislative Research Department to assist the legislature and also the state of Kansas with information on different things. And I asked if there were any actions recently at the state level about 988. And they mentioned that in the 2021 omnibus bill, which was Senate Bill 159, the Kansas legislature did appropriate some state general fund money, $3 million, operational cost associated with the 988 number. That funding did go to the Kansas Department for Aging and Disability Services, or KDADS. There was some information in there that if federal funding was identified, to use that instead. There is a bill that was introduced this past session that did not pass, but it's still pending in the Appropriations Committee. And that is House Bill 2281. And that would charge a 50-cent fee for each telephone subscriber to pay for the operational cost of the 988 number. As I mentioned, that bill has not, to my knowledge, had a hearing or has not passed for sure, but it is still alive. It's in House Appropriations. And should that bill pass, that would take over primarily the funding going forward. In terms of other operational costs, the legislature did approve $5 million from the State General Fund in KDAD's budget for the new statewide mobile response program, which I believe is a little more broad than the National Suicide Hotline. But that would assist with the hotline to make sure that services can be provided across the state. So Matt Moore, fiscal analyst with KLRD, did help me out with some of that information, so I appreciate that. But yeah, I include a sheet with that information for you in your packet as well.
Appreciate that update. Anybody have any questions? All right. The next item is the continuing education requirement in diversity, equity, and inclusion. And again, I had a memory we had discussed this, and that I think Tom had raised the issue of saying that although important, if we add this, then it's opens the door to adding extra specific requirements around specific areas or populations. And currently our regs already say you shouldn't practice within a group or a scope that you're not competent and trained in. Is that accurate in my memory?
Yes, I recall that conversation too. And just to let you know what some of the other advisory committees had discussed, most of the professions have 3 hours of continuing education required every 2-year renewal cycle, and then 6 hours required in diagnosis and treatment. And so about half the advisory committees recommended a change regarding this issue, and about half had conversations and were supportive but didn't recommend a change right now. So the board is planning to discuss this item further at the September 27th meeting. But one possible proposal that has been discussed would be to reduce the number of required hours in diagnosis and treatment from 6 to 3, and then basically change it to requiring those 3 hours in this area instead. So you wouldn't be requiring any more than the 9 hours that were already required. It would be a shift of reducing the diagnosis and treatment requirement from 6 to 3, and then requiring those 3 hours in this category instead. So that has been also discussed by the advisory committee.
Thank you. People have thoughts about that?
I was trying to remember why it was brought up. Was there specific concerns or an increase in issues in that area?
So the representatives from the Kansas Psychological Association had requested public comment time to talk to the Licensed Psychology Advisory Committee to formally request change. And in their initial proposal, they were saying they would be fine if we could require 3 hours in this area and then double count the hours with ethics. So that was kind of the approach that they initially took. Currently, the Bsrb doesn't really double count hours. We look to see 3 hours identified for this category, and then we look elsewhere for the other requirements. So, so that really hasn't been something that has been officially decided in regards to the double counting. But that's where some of this started at the at least our state level. I can tell you, attending some of these National Association meetings, it is a topic that has been discussed by other states, and I think there have been some speakers talking to these issues in regards to making sure that practitioners understand some of the differences relating to some of these topics, and then what's going on in terms of the national level regarding these issues too. So those things have been discussed at the national level, but I think how it first approached us at the state level was probably through that Licensed Psychology Advisory Committee, and then the other advisory committees decided to discuss these and weigh in. And so we asked the other advisory committees, would you also like to discuss this and take a position?
Thank you.
I'm trying to think of how to phrase this. My best approach is this seems to be a very broad definition or suggestion, and I would be concerned that without further specificity, I don't know what we are gaining with this. Personally, I'm not in favor of reducing our diagnosis and treatment hours in place of this, especially without further clarity on exactly what we are accomplishing here.
I think one of the things sorry, Susan, go ahead.
I was just going to a certain degree support what Tom said. If I had to trade anything, when I think about diversity, equity, and inclusion, having an understanding of what ethics is and incorporating the two, I could see that those two could be combined in some way, more so than taking our diagnosis and treatment away.
Go ahead, Josh.
Sorry. I was going to kind of echo what Tom said a little bit too. I think one of the things we talked about last time was I feel like I already get a lot of that in a lot of the CEUs that I already take. It's part of a lot of whether it's diagnosis or treatment or ethics. And I just think from a practical standpoint, attaining those hours may be difficult. And I don't know what it adds just because I already think it's part of a lot of other trainings.
Yeah, I agree as well. I would hate to see us reduce our diagnosis and treatment hours. And I know that for us, we've got a couple specific trainings. One's around working with people who've been in the military, and one's around working with people who are involved in farming and agriculture, and it involves several different trainings, not just kind of one, to Tom's point, kind of broad and ambiguous training, but much more specific to understanding the cultures and understanding what the specific issues are when people from those communities seek treatment. And I think that's a really great idea when people kind of create a training that says if you're going to work with a specific population, there may be really important things you need to understand. But we require people to get quite a few hours of training. There's lots of room to get that kind of a training without it being one, taking up the diagnosis, treatment, or ethics piece. But, you know, to Susan's point, if somebody wanted to combine an ethics training with specific information about working with this population, or I've seen some diagnosis and treatment trainings that talked about this, as other people have mentioned, it seems to be becoming more included in a lot of the training. So it sounds like we kind of have a consensus that from our group's perspective, we're not in favor of this being required, nor are we in favor of reducing the diagnosis treatment current requirements. Does that sound right?
Agreed.
Agreed.
Yes.
Very good. That takes us to in residence. And Dave, can you summarize just briefly maybe the particular reason that this is an important issue for us in terms of the
Sure.
online, in particular, the online degrees people have come to try and get licensed with?
Sure. And I'll talk about it sort of in a broad sense. So our requirements in Kansas do call for there to be certain education that you should receive in residence or on location when you're receiving your education. There are a number of programs now that are fully online or primarily online. And the board wanted to collect information and feedback on whether there should be changes to the requirements in regards to this in residence rule in terms of some of the education that has to be received. And so back, I believe in May, or maybe it was April, we sent out a letter to the colleges and universities in Kansas and representatives of the different professions, collecting information from those educational facilities in regards to, there's not a specific proposal on what would be changed, but do you have any input you would like the board to consider on potential changes to the in-residence rules in terms of education? And that information was collected and reviewed by the board, I believe, back in the May meeting. And the feedback did vary. Some of the professions, some individuals said they believed it would be helpful to open it up. Some said there are certain things that really, it would be very hard to have productive training on certain tests or different things if you were doing it all online. And perhaps online treatment is a part of treatment, but there are things that potentially would be missed if you didn't have any person-to-person interaction in terms of some of those education requirements. So I'm broadly summarizing. There was a lot more thought in those messages, but that information was collected and reviewed by the board. And the board did say too that they wanted to open it up. And so if the advisory committees wanted to add any other input, that might be helpful, because the board does plan to discuss this issue broadly at the September 27th offsite board meeting as well.
And where this really, hits for us is a couple of places. One, because our training programs, particularly around testing and the need for kind of a face-to-face experience doing that, clinical work. And oftentimes people who get doctoral degrees from online universities, if they try to get licensed in the state at the licensed psychologist level and they can't, they often drop down wanting to then come in as an LMLP. And what has prevented a number of them has been this in-residence requirement, because their particular programs don't have them attending classes kind of on campus. And so it's one of those kind of struggles between making sure that we are requiring adequate training and licensing, professionals who know what they're doing, meeting what is clearly a workforce shortage, and also, I think, looking at the programs that we currently have that we license, and making sure that people who come from out of state have the same quality education as those that are being produced here and easily able to get licensed. And I guess the other piece would be then the reality of what we're doing right now and the changes in technology and the fact that we're doing so much more work and meetings and education remotely. Josh is our resident educator. You want to weigh in?
Yeah, I've been trying to reflect on a lot of what we talked about several months ago, which seems like a while ago. I think you summarized it pretty well, Dave. I, of course, see a great need for not making the in-residency requirements any stricter than they already are, in terms of allowing virtual education because of the shortage, and being able to serve rural areas. And the advancement of virtual education is a big part of that. There are a lot of tools out there now, a lot of ways to deliver things in creative ways, and there's a lot of research that shows too that there are students that learn better online. We can't hold on-campus training as superior for every student. And the only other thing I'd say is, I think we talked about it briefly, but there is some language too, I think somewhere, about core faculty having to teach something, and I know we had talked about that too, because I think most people were pretty on board with the idea that there's great benefit from people who may be part-time or adjunct instructors who have a lot of experience in the field teaching some of those courses, instead of just core faculty that sometimes don't have as much experience in the field. So that's all I got.
I appreciate your thoughts, Josh. One of the things that sort of comes to mind for me is I'm fine with us, not being any more restrictive than what we are and being adaptive to current technologies, but remaining mindful that one of our primary purposes is the safety of the population.
Yes, I completely agree, Tom. That I thought of that too. What Dave was speaking. That's a big part of what we. Go ahead, Susan.
I'm really in favor of virtual learning. I think, though, that the pieces that need to be kept is that direct internship of experience. I think there's a lot of ways, like Josh said, for virtual learning to happen with the different cameras, the different options of demonstrating things to show that you are proficient at administering testing items, things like that. And I think we've made a lot of progress in the way virtual education has moved forward. And I think also that in the profession, there are people already moving forward with administering different tests online too. So I think that's going to move and change our profession also. But I think the key is, how do students get experience and practice before they become a practitioner? And I think that's the biggest key that I think is the most important to maintain.
To share on that note, Susan, that's really important. One thing to think about, I don't know if this kind of addresses what we're talking about a bit, but we met with our social work department at Fort Hays and thinking about our program, and they have done some really impressive things. They have this program that catalogs internship sites all over the US, outside of Kansas too. They have to have approved internship sites. Students have access to that. So they have to pick from this long kind of internship sites. They can vet those. And then every week they actually have it's a field instructor or some sort of position who's sending out things to every internship site, kind of, just recommendations on what students should be thinking about or learning. And they're very involved. And I was really impressed with the level of kind of vetting that they do to make sure that their students are getting experiences for their internships and practicums. It certainly wasn't just like, well, I hope you can find something to fulfill this requirement, which I thought was, again, just really impressive. And that's something I know that with our program, we're acquiring the same software to start building that catalog of things and start vetting sites, which I think is very good and very important. Iris?
I just think there's definite elements that are really important in person. So I'm not against doing a lot virtual, but I think there's just a lot that is important to do in person. And like Susan was saying, especially, and those examples are great that Josh gave. So.
Dave, do we have any sense of what other states are doing in terms of kind of modifying their rules and regs as the technology has improved?
So some of this conversation has been, I think there have been a number of speakers at the national level on what endemic related changes have you made. And I know that certain requirements have been relaxed in this area temporarily. But most of the conversation has been limited to what temporary changes have you made versus has it spurred permanent change in that area. So I'll add it to my list, and I'll look to see if there were any bills introduced in other states this year, and just see if there's any other movement in this area because of the pandemic or just things moving in that direction.
And it does seem, Dave, you can correct me if I'm wrong, but it does seem like some of these online programs have kind of gotten the message and adjusted how they do things to make sure that their students are able to get licensed who have struggled in the past because of some of these requirements.
Yeah, I've heard some conversation that there's quite a bit more online learning, and that there has kind of been a little bit of a call to I don't even know how to say it exactly, but how to have someone evaluate the strength of online programs, comparing online programs to each other, to see who is utilizing things online in a really productive way, because there is quite a bit of range in terms of how things are being done online now. But I don't know that has really been fully fleshed out. I feel like we're kind of in a time of movement in this area. So I'll do some more digging on that. I'll try to bring something back maybe for the next advisory committee meeting to talk a little bit more about to you guys.
I think that's what worries me, is that, yeah, there could be such a variety among those. And so I would find that very interesting.
I would hope that we would have some consistency, not necessarily identical regulations, but at least pretty good consistency across the disciplines of the Bsrb. It would seem really strange if licensed psychologists said absolutely not, and another group said, sure, 100% is okay. I don't think that gives a very good message when our discipline is data driven. That there should be consistency across those.
Yeah, and I think that's one of the things, that they've wrestled with, in part because, like, the social work group, since they're not doing any components of testing, then that's a piece that they don't have to think about. Theirs is more just looking at clinical practice. And so it is, an interesting kind of ongoing discussion. And I think I shared with you guys before that we had somebody apply for a license and they got denied. And then during the appeal, when I was asking about, well, how did you do your testing training? And they said, well, we got together and some of the adults pretended they were kids, and we learned how to test kids by working with adults pretending to be kids. And I thought, wow, that's not exactly the standard I think we would want to hold up. In terms of the in-residence parts, like that particular educational group was doing regional meetings where they would have students come to a large hotel and spend a couple weeks, all the students together with the faculty. And because it wasn't a formal part of the university campus, it didn't count as meeting in residence. And it was, again, one of those things where people were saying, is just stepping foot on the grounds of the campus, is that what's important, or is it, what's really going on during that time that they're all together? And so that's going to be part of this discussion. The in-residence piece, I think Josh also alluded to the kind of core faculty. You know, the idea that most of the classes are being taught by people whose primary employer is the educational agency and not a group of folks whose primary job is something else. And I think that can cut both ways, as Josh indicated. You know, sometimes bringing in people who are actually out there doing private practice and doing clinical work to do some of those classes is probably a great benefit, as opposed to somebody who's been in the department for 20 years and maybe isn't as in touch with what kind of more up-to-date current state-of-the-art clinical practices. Y'all have thoughts about that?
Sometimes when I think about it, I think about clinical competencies and what should those be? Because they often come up within our agency that every 2 years, somebody should be evaluated to make sure they have maintained their clinical competency. And so how do you incorporate the clinical competencies that we would feel are important within an educational program, whether it be virtual or not virtual or a combination? I think those pieces, maybe Josh or other educators could help define what they are. Because oftentimes, you know, how do we police our own group through Bsrb or through ourselves so that it doesn't end up being a Bsrb problem too? So I think figuring out what those competencies are within an education program also is maybe a key factor there. How do students meet competency?
And that does go kind of hand in hand, I think, right, Josh, that in order to get licensed, you have to be a graduate of a program that has a certain number of hours in certain areas, and most of those programs are established so as to meet the criteria established by the state in order to get licensed. So it's kind of designed so that when their students are done, that they meet at least the minimal requirements. But again, it does often, how often do we look at those, and are we still training people the same way we were all trained? Or are we looking at different things now that we know more about what the people these practitioners will serve really need?
Yeah, I'm thinking on things. I think Susan brought up some good thoughts. They're big thoughts, so I'm just kind of thinking.
Dave, is there anything specific that you're aware of that the full board is going to look at in terms of changing the issues around the in-residence?
No, I'm not aware of any specific changes being considered. It's more just the topic itself, and I think taking into account all the different feedback the board has collected to see, is this something the board wants to pursue, trying to figure out that a change should be made, and if so, maybe go from there in terms of looking at a specific way that maybe a change could be made. But right now, I don't believe there's been a specific change that the board is considering.
Very good.
Have the disciplinary or the disciplines had any significant changes to their accreditation requirements for these programs along the lines of what we're talking about?
And I'm not sure I can really speak to that. I can look into that, and I'll talk to Leslie Allen, the assistant director and licensing manager, and see if she's received any information on that topic. But I'll try to bring that back to you at the next meeting.
Yeah, my thinking on that really was, let's just take the APA as an example. If they have certain requirements for accreditation of programs, how do our regulations match up to that? I'm not saying that we should follow those accrediting standards versus leading, but it's good to know where are the disciplines in terms of this evolving system, these technologies.
I think that's one of the challenges for our particular group, is that we don't have a national group that provides those kind of program qualifications like the APA, and there's one for the National Counseling Group and the Social Work Group. Is there a marriage and family therapy?
I believe there is. Yep.
Yeah. And I know that there was some talk, I think Susan had mentioned this previously, that the APA was kind of looking at whether or not they wanted to join forces with the master's levels and maybe even provide some feedback as to how to accredit master's programs.
May want to stay in touch with Leo Herman, because he's the one that's really been following that.
Well, very good, Josh. Maybe you could reach out to Leo and
Yeah, I'll see him tomorrow. I'll ask him.
all right. Well, in the looks like we're running out of time, so let's move to new business. David sent out a notice about the APA meeting in regard to possible ethics code changes. Was anybody able to participate in that? I was not. Well, we'll have to then get an update from our friends in the Licensed Psychologist Advisory Committee to see what the APA is looking at in terms of changes to their ethics code.
Yeah.
I
I
was
apologize
on,
for not having more information. Okay.
I was on for a
Yeah,
little
that's
while.
fine.
I was on for a little while, and the part that I listened to was they're discussing the diversity, equity, and inclusion in regard to adding something about ethics. And the other piece that they really talked about is how do they make their ethics more global so that it fits all the divisions of psychology. So those were the two pieces that I was on for, but I wasn't able to stay for the whole thing.
I appreciate your update. Maybe that's the kind of discussions that push the KPA towards their discussion with the Licensed Psychology Advisory Committee about those issues around diversity, equity, and inclusion. All right, future meeting. Obviously, unfortunately, with the uptick in COVID, and even amongst folks who've had their vaccination, probably the idea of having anything in person will be put on the back burner for the time being, doing what we can to kind of ensure everybody's safety. But it's still my hope at some point that we can at least do one in-person meeting. But until that time, we will continue to host these via Zoom. I appreciate, Dave, you and your staffs getting all the information out to us prior to the meetings. That's always really helpful. If we look at a calendar, that would be October, is that right?
Yes.
All right. How does the 12th at 10 look?
Good for
Go
me.
back to, we usually have management meetings on Tuesday mornings. This one just happened to work for me.
It's not a good day or
Sorry.
time.
Tuesday mornings are usually management meetings for me.
All morning, just,
Yeah, usually till 11 or 12.
okay.
What about Tuesday afternoons?
Yeah.
At a standing Tuesday afternoon CCBHC meeting, so that's kind of out for me. About the 14th, the morning of. Iris, you look like I stepped again right on the bad part of your schedule. But you're muted now. You can't hear.
Sorry. I usually have meetings Thursday mornings too. I can look at changing it if that's what works, because I'm in charge of that one.
Does it work for everybody else?
Yeah.
That would work. David, this just raises a question for Susan and I. If the recommendations that Dave takes forward are accepted and the chair appoints new members, when would those changes take place?
So those would most likely take place, the board would make the decision, or the chair of the board, at the September 13th meeting, and then would appoint members to start attending those meetings at the next meeting in October. So it would probably take place in between this meeting and the next meeting in the advisory committee.
Okay, so you just let us know when it's time for us not to show up anymore.
Sure,
Yeah.
I'll give you an update.
We'll find out, but I appreciate you raising that. It kind of slipped in my mind in terms of thinking about that. So, given that we're going to have 3 new people, we'll set it as a tentative date for the 14th and then see how it fits their schedules.
And Dave, what time is that meeting on the 14th?
10? Does that work?
Yeah. Okay.
So tentatively, do you think we should plan or not plan for Tom and I? Or do we say that's a transition meeting? That's our last one, basically? Or we call, or what? That's.
I assume, Dave, and you tell me if I'm wrong, but once they, because not only does the chair add, but the chair removes, right?
That's right. Yep.
Okay.
Yeah. So we will know after the next board meeting in September, the full board, whether those recommendations have been accepted. And so we'll be able to give you a month's notice if in the weird circumstance that she declined all of our recommendations, which I can't imagine happening. So this would be then likely the last meeting for you all. And again, I just want to say personally, and on behalf of the board, how much we appreciate your hard work on behalf of the LMLP. And I imagine that means you guys were on this group back when that's all there were LMLPs. There weren't even LCPs.
I think that's right, or somewhere right around that time. I'm not sure the exact details.
Because we actually started as registered master's level psychologists, right?
Mhm.
Correct.
Yeah.
Yeah.
Well, Dave, I want to echo your comments. I know Tom and Susan, I haven't had a long chance to work with both of you, but I really appreciate all your years of service helping out the board and serving on the advisory committee. And so I want to say thank you as well. And so thank you for all your years of service.
Thank you.
Anything else before we wrap up?
It was nice working with both you guys, Tom and Susan.
Yes, I echo that for sure. Appreciate everything.
Thank you.
Well, and
You're most welcome.
hopefully we'll get to a place where people are out and about a little more freely and our paths will cross in person. All right, thank you all. Wonderful meeting. I really appreciate it. Stay safe and enjoy what's left of your summer.
Thank you.
Okay, thanks very much.
Dave, could we get a motion to adjourn?
Ah, sure.
Also move.
There
I'll
we go.
second.
All right. All in favor, say aye.
Bye.
Aye.
And or, disconnect. Thank you all.
Thank you.
Bye.